Hi, my name is Jessica Aguayo, and for my project number 5, I did diabetes medical research. What is diabetes? Diabetes is a disease that occurs when your glucose, or can also called blood sugar, is too high. Blood glucose is your main source of energy and comes from the food you eat. Insulin, a hormone made by the pancreas, helps glucose from food get into your cells to be used for energy. Sometimes your body doesn't make enough or any insulin. Glucose then stays in your blood and doesn't reach your cells. Over time, having too much glucose in your body can cause health problems. How was it discovered? The first known mention of diabetes symptom was in 1552 BC when Hezi-Ra, an Egyptian physician, documented frequent urination as a symptom of a mysterious disease. Around the same time, ancient healers noted that the ants seemed to be attracted to the urine of people who had this disease. In 1889, Joseph von Murray and Oskar Minkowski discovered the role of pancreas in diabetes. They found that the dogs whose pancreas was removed developed all signs and symptoms of diabetes and died shortly afterwards. 1910, Sir Edward Albert Sharpie Schaffer found that diabetes resulted from the lack of insulin. What are some symptoms? The symptoms are increased thirst, frequent urination, extreme hunger, unexplained weight loss, fatigue, irritability, blurred vision, slow healing sores, numbness or tingling in the feet or hands, frequent infections such as gums or skin infections and vaginal infections. Types of diabetes. There's multiple types of diabetes, mainly focusing on the most popular ones. Most common ones. Type 1 is that your body does not make any insulin. Your immune system attacks and destroys the cells in your pancreas that makes the insulin. Scientists think that type 1 is caused by genes and environmental factors such as viruses that may trigger the disease. Type 1 is usually diagnosed in children and young adults. Although it can appear at any age, people with type 1 need to take insulin every day to stay alive. Type 2. Type 2, your body does not make enough insulin. You can develop types 2 diabetes at any age during childhood, even during childhood. However, this type of diabetes occurs more often in middle age and older people. Type 2 is the most common type of diabetes. There's also gestational, I'm so sorry, diabetes. It develops in some women when they're pregnant. Most of the time, the type of diabetes goes away after the baby is born. However, if you had this type of diabetes, you have a greater risk of chances of developing type 2 later in life. Sometimes diabetes diagnosed during pregnancy is actually type 2. Um, the less common types include monogenic diabetes, which is a genetic form of diabetes, and cystic fibrosis related diabetes, which is similar to type 1 but with complications. The health problems over time, how high blood pressure, high glucose leads to problems such as heart disease, stroke, kidney disease, eye problems, dental disease, nerve damage, and foot problems. How can you get it? You're most likely to get type 2 diabetes if age 45 or older, have a family history of diabetes, or are overweight. Physical inactivity, race, and certain health problems such as high blood pressure can also affect your chances of developing type 2. You are also most likely to develop type 2 if you have prediabetes or had the gestational diabetes when you were pregnant. Symptoms of type 1 diabetes can start quickly in a matter of weeks. Symptoms of type 2 can often develop slower over the course of several years and can be so mild that you might not even notice them. Many people with type 2 have no symptoms. Some people do not find out they have the disease until they have diabetes related health problems such as blurred visions or heart troubles. How to prevent? Type 1 can't be prevented. However, the same healthy lifestyle choices help pre- that help treat prediabetes type 2 can and instantial diabetes can also help prevent them. So what you can do is you can eat healthy foods, get more physical activity, and lose the excess pounds. Sometimes medication is an option as well. Oral diabetes drugs such as metformin may reduce the risk of type 2 diabetes, but healthy lifestyle choices remain essential. Have your blood tr- your had have your blood sugar checked at least once a year to check that you haven't developed type 2. That's all I have, and I'm sorry there's a lot of words I could not pronounce. My apologies. But thank you for watching.